Hi, I'm Ariel Compucius, a reference and liaison librarian at the University of Florida Health Science Center Libraries. This video discusses gray literature beyond commercially published books and journals. Gray literature may be useful to your research, particularly those resources with relevant coverage for health outcomes and policy topics. So what is gray literature? Gray literature is that which is produced on all levels of government, academics, business, and industry, but which is not controlled by commercial publishers. Gray literature can include conference proceedings, abstracts, theses, dissertations, clinical trials, newsletters, pamphlets, brochures, reports from foundations or think tanks, fact sheets, bulletins, government documents, surveys, interviews, and informal communication such as blogs, podcasts, and tweets. Basically, gray literature is a term that encompasses anything that is not published in a book or journal. You may have heard the terms gray literature and white papers thrown around interchangeably. White papers is a term that usually refers to government reports or documents, meaning the document is considered authoritative. However, white papers can sometimes refer to commercial publications by corporations, which means that evaluation will be needed to ensure the source is authoritative. Gray literature, as we have already discussed, refers to a variety of information resources that are not published by commercial publishers. Since gray literature is not necessarily peer-reviewed, you will need to evaluate the authority and veracity of the information for yourself. So when you're talking about white papers and gray literature, all white papers would be considered gray literature, but not all gray literature is white papers. While you may be more likely to trust the authority of a white paper, you'd be wise to always analyze and evaluate the information you are given in gray literature sources. Because gray literature isn't commercially published and encompasses so many different types of information resources, it can be harder to find. Some suggestions for finding gray literature include searching by different agencies and organizations, such as government agencies, advocacy groups, or private agencies, which includes foundations and think tanks, and industry, trade, or professional organizations. You can also search by databases. PubMed has filters that allow you to search for conference proceedings, dissertations, letters, etc. There are also databases for registered trials like clinicaltrials.gov, which shows results before publications. And institutional repositories can include abstracts, posters, and preprints. In contrast to evidence-based medicine, where you are expected to find peer-reviewed publications through databases, you can also search the wilds of the internet for gray literature. However, when you take the risk of finding health information in the wilds of the internet, the burden of evaluating the resources for accuracy and authority falls to you. Gray literature is important for providing a more comprehensive view of research by exploring information outside of the traditional publications produced commercially, such as academic journals and books. Because the sources are not published commercially, gray literature avoids publication bias and positive results bias. Publishing in major academic journals is very competitive, and not all articles will be accepted, even if they are relevant and important to the field. In addition, journals are more likely to accept articles on positive results, and so scientists are not necessarily eager to write up negative study results. Searching the gray literature out overcomes these publication bias and ensures that you are getting the full story. Gray literature can also help avoid publication lag. The turnaround from the time a study is finished to the time a study is published in an academic journal can take months, and even years. However, sometimes the information is available in advance of the official publications, either in conference presentations or preprints or registered trials. Searching the gray literature helps you find the most recent information, sometimes before the journals publish it. Gray literature is particularly useful for health policy research. Health policy information is always changing and can be difficult for commercial publications to keep up. Health technology assessments, economic evaluations, health systems impact assessments, and comparative effectiveness research are often in the gray literature. Since not all gray literature is subject to peer review, you must evaluate the resources you use. When you evaluate gray literature, you need to analyze the accuracy, authority, bias, and objectivity, currency, and coverage of the information resource. More details on evaluating resources can be found in the Critical Analysis of Information video. As always, please feel free to contact the library if you have any questions, either using our general contact information or by getting in touch with your liaison librarian directly, listed by class on our liaisons page. For more materials on information resources of all varieties, see our guide, UF Information Resources for Medical Students.